bills, including funding for grants to cover unreimbursed health care expenses and increased access to digital health care delivery. There's going to be direct checks for families. In addition, there will be small business loans to cover daily operations, including payroll and rent to keep the doors open. Expanded unemployment benefits and training dollars for dislocated workers are included as well. We know that there's additional assistance for food banks and SNAP benefits to help our most vulnerable citizens. There also will be additional funding for child nutrition programs to make sure that our children still receive meals while they're not attending school. Rest assured that all of our state agencies are combing through the bill to make sure that we identify every bit of funding and assistance, flexibility that we can take advantage of. But let me just say we're very grateful to our congressional delegation for the work that they did in helping to get this important bill passed. As I just mentioned, we're in the process of studying what the bill contains for Louisiana, but we do know that Louisiana is estimated to get $1.8 billion in direct federal aid from the federal government. We've also been led to believe that that funding could be available to us in as little as 30 days. Obviously, that will be very helpful. We are one day deeper into this event, and while we don't know what the duration will be, we do know that we are doing everything within our power to respond to this crisis, and we need everyone. I implore everyone to do their part as well, and that means staying home, minimizing your travel, minimizing your social contact. The numbers that we report to you every day should underscore why slowing the spread of this virus is so important. And as of noon today, Louisiana has reported 2,746 cases of COVID-19. Now that is 441 cases more than yesterday. That is a 19% increase in the last 24 hours. Now there's some good news and some not so good news. It's a lower number from yesterday's increase of 510, and yesterday's growth was 28%, and today's was 19. But I want you all to keep in mind today's increase was only from half as many tests. So it's a mixed bag, and we are trying to figure out what it means. And there's a lot of information that you have to know, much of which I don't think we actually have right now. But I've asked my team, including Dr. Bu, to make sure that we're analyzing these numbers so we can glean as quickly as possible what the trends are. But I can tell you, as far as what we know, we still remain on the growth curve, that the trajectory that we don't like, the one that we need to flatten just as soon as possible. The other news that really there's no way to spin it or misinterpret it, we now have 119 deaths. That's an increase of 36 deaths since our last update. This is the largest increase in deaths yet to be reported on a daily basis. Yesterday we had 18 deaths. You will also see, if you look at the video monitor here, that New Orleans has surpassed 1,000 cases. I'd also point out that we now have 200 cases in the 4 most northwestern parishes. And I point that out just so that everyone understands that this is, in fact, spread all across the state of Louisiana. We have cases in all but 9 of our 64 parishes now. And nobody should think that they don't have the virus, the novel coronavirus, or that they don't have COVID-19 in their parishes. I can assure you it's in every parish, in every community across the state of Louisiana. Getting back to the deaths that we have reported, up to now 119 of them. Early analysis indicates that conditions among those COVID-19 deaths include diabetes, 41%, kidney disease, 31%, and obesity, 28%. Louisiana is third in the nation per capita for the number of cases. We are second I believe, per capita in the number of deaths. Obviously, this is a public health emergency as it has been described, and it shows no signs yet of abating. And I want to encourage everyone to take this extremely seriously. You've heard me say it before, but medical surge is our number one priority in terms of what we as a state are doing. The number one priority in terms of what I'm asking the citizens of our state to do is to minimize the spread by practicing the mitigation measures that we put in place, the social distancing, the stay-at-home order, and so forth. But on the medical surge part of this, we remain on the trend line that we've been on for a few days, and that is under current modeling that we would run out of ventilators sometime around April the 2nd or 3rd in Region 1, down around New Orleans, for those patients who need ventilators. Just to put into context to people how hard it is to acquire new ventilators, we have put in many days ago orders for 12,000 ventilators. I think 5,000 of those from the Strategic National Stockpile, the remainder from private vendors and manufacturers, and to date we have received exactly 192. Those 192 ventilators have all been allocated and delivered. We do expect a shipment of another 100 early next week, but we need several thousand ventilators. We're going to keep working on this, obviously. And I would remind everybody that when we overwhelm our capacity, our hospital's capacity to deliver care, it doesn't just threaten COVID-19 patients. It threatens everybody who might need emergency or intensive care at a hospital. Whether you're a motor vehicle accident, a heart attack victim, or a stroke victim, or whatever. And so I'm asking everyone to do what they can to be a good neighbor, to lower the number of cases that we are announcing every day, start to flatten that curve. Incredibly important. One piece of relatively good news is that the state of Louisiana is in the top 5 states on a per capita basis for testing. And we have surged our testing capacity, our lab throughput, tremendously. I will not tell you that we're testing in the numbers that we would like. I do anticipate that the testing sites, the number of tests administered, the number of test results that we get every day will continue to climb. And we need to test all across Louisiana, including in our rural areas. Yesterday I talked about how we need additional medical staffing. Today I'm happy to say that Delta Airlines has offered to fly any healthcare professional volunteers responding to the COVID-19 crisis here in Louisiana for free. Travel will be booked for participants once they have registered and become credentialed through this website, lava.dhh.louisiana.gov. That's lava.dhh.louisiana.gov. Again, before they arrive, they have to register and become credentialed through Louisiana's Volunteers in Action, lava.dhh.louisiana.gov. Once they are credentialed, they will be contacted and given their assignments and instructions on where to report. And I want to thank in advance each of the healthcare professionals who volunteer to come to Louisiana and help with this public health emergency. I also want to make sure, and by the way, it sort of frustrates me to have to respond to rumors, but we have to do that on occasion. I want to assure people that we have absolutely no plans to close any state roads or bridges due to COVID-19. As always, for traffic information or other routine road closures, please check 511la.org for the latest travel information. 511la.org. For business owners, in order to answer your questions, the state of Louisiana has established key COVID-19 resources at LED. You'll find an extensive list of links to resources from state and federal government by visiting gov.la.gov/coronavirus. gov.la.gov/coronavirus. If you have a non-business question or general inquiry having to do with COVID-19, please dial 211. Call 211. Finally, I must continue to stress how important it is that everyone stay home. The measures that we take from a state standpoint can only go so far. The success that we will have in slowing the spread will be dependent upon individuals all across the state of Louisiana. So please, no unnecessary travel. Stay home. Continue to wash your hands frequently and for 20 seconds using soap and water. Use hand sanitizer when you don't have access to soap and water. Cover your cough. Practice social distancing of at least 6 feet between you and someone else if you have to be out and about. If we're going to flatten the curve, if we're going to lessen the burden on our healthcare system, if we are going to save lives, we must have full cooperation from all Louisianans, and we have to have it now because, quite frankly, we don't have much longer to wait. April the 2nd, coming up sooner than we would like. So with that, I will be happy to take your questions. I will remind you that, again, I have Dr. Alex Biu here from the Department of Health to take any questions specifically related to testing. Yes, sir.
Governor, the Surgeon General this morning said next week, this upcoming week, New Orleans could see New York-like numbers. From the data you're seeing and looking over, is that something that you might agree with? And if so, is that just in the New Orleans area or in other pockets, other swaths of the state?
Well, look, we're number 3 in the country per capita right now. The trajectory we're on right now is one that takes us to a place where we're not going to be capable of delivering the health care that will be demanded of our hospitals. So I concur with him if we stay on this trajectory, and you know, it's not that hard to understand. It is a very difficult concept to come to grasp with because the situation is that serious and that dire. But I agree with him, and I will tell you, the Surgeon General has made himself available to me specifically on a number of cases. And you remember that he was actually here in Louisiana, and I'm guess it was 2 weeks ago yesterday. It seems like a long time ago, but it was just 2 weeks ago yesterday. He was in the state with us, and so I would have to say that I think he's probably right. But what we should start to see very soon, because we know that these mitigation measures work. We know that social distancing works to slow the spread. So we really should start seeing that show up in our data soon. And I'm looking for the day when my team comes to me and they tell me, aha, we see that curve start to flatten. But until then, we have every reason to believe that we're headed towards New York. Now, the way you ask the questions, we're not going to get to their numbers, but only because we don't have their population. And the reason that's important, and the reason I continue to focus on the per capita numbers, as I have stated before, that any state's healthcare delivery system is sized to meet its population. And so if you have the third most cases per capita, then that means that at least at that time, and so long as you're on that trajectory, that you're very likely to exceed your state's capacity to deliver health care. Yes, ma'am.
Can you give an update on the plans with the convention center and what's happening there, and also the field hospitals that are promised from the federal government?
Okay, so the field hospitals, what we got, we had requested 250 bed units. We were approved for 2, so these are going to be 500. So these are basically hospital cots. I don't want to say beds, but they're not an Army cot either. They're somewhere in the middle with IV poles and some other things, and they are separate from staffing. So we will use those in the Morial Convention Center to set up our medical monitoring facility, and it's going to be very, very helpful to us. That facility will, in fact, they're working there today, and they're going to build this out in wings of 120 rooms each. The contract will require that they put up 1,120 beds in the convention center, and we will then staff that facility primarily through a staffing contract that we are executing here at GOSEP. And then we have wraparound services for cleaning, laundry, food service, things of that nature. Now, we do have a strike team coming, which are 60 medical professionals from the U.S. Public Health Service. That will be very, very helpful because we will use them to augment the staffing that we bring in order to deliver health care in the Morial Convention Center. And we are looking at other options as well to increase our capacity. And we are looking at other facilities, and we're looking at other hotels. I don't have any news to deliver to you at this point. But this is step-down capacity. So the idea is that we would have a facility to send patients once they no longer need that acute care bed or an ICU bed, and allow the hospitals to free that bed up sooner by having a place to transfer their patients. And that's one additional way that you can surge your medical capacity. So that's what we're intending to do with the facility that we're setting up. We're going to have more information about this soon. You can see, I think there was some TV coverage today of what they're doing in New York. The concept, as I understand it, is very, very similar between what we're trying to do here in Louisiana and what they're doing in New York. Yes, sir.
Can you tell me generally what the state would be getting with the $1.8 billion from the stimulus package?
Well, the $1.8 billion in funding we should have over at some point in the next 30 days. We are trying to figure out exactly what flexibility we have with that funding. To one degree or another, we know that it's going to have to be spent on those things that are related to this COVID-19 public health emergency. But just about everything the state government is doing these days is related to this emergency. So we're still looking at that. I can only tell you that we are very thankful to be getting that, because right now, even if we, as you know, we have the federal government paying 75% of the cost of things that we're doing here at GOSEP and across the state related to COVID-19. But that's still 25% that we have to come up with. And so this will be very helpful in that regard. And I will tell you the degree to which law enforcement benefits through the additional allocation of money going through the Burn Grant program, for example, that's going to be helpful. The money that goes directly to our hospitals is going to be helpful as well. It's too early for me to tell you right now exactly how that money will be spent. I can only tell you that it's going to be very, very helpful. And the more flexibility that we find as we study this bill and as it gets interpreted by the federal agencies administering the program, the better off we're going to be. Yes, sir.
My question is for Dr. Bu. Actually, 69 of the folks who have passed so far from COVID-19 were either diabetic or obese, which are both pretty common health conditions in Louisiana. To what degree should the average diabetic or the average person who is overweight be concerned by those numbers?
Well, I mean, I think that in general it's a cause of concern for our population. You've been hearing a pretty consistent message from us that everybody has reason to be concerned and to take actions to protect themselves and their families from COVID-19. We unfortunately announced a death in a 17-year-old yesterday. I mean, we know that the people who are at the highest risk are the people who are in the older age group, but we also know that people with conditions like, as you're seeing, diabetes, kidney disease, and obesity are also at really high risk for bad outcomes. And so to the extent that you're somebody that has those conditions, we want you to take those steps to really stay at home, have somebody else do the shopping for you, limit your exposure to people who are sick, wash your hands frequently, all those things we've been saying. But even if you're not in those groups, we want you to do all those things for the loved ones around you that we know have those conditions. We want not only to not see as many hospital admissions, we want to see the rate of death decrease as well in the state. And the only way we can do that is by taking these measures seriously and thinking not only about our risk, but the risk to our family and the risk to our neighbors, as you've heard the governor say.
Just as a follow-up, were those were those 69 people, were they like extremely diabetic, extremely overweight? Do we know the degree of that?
So I don't know the specifics of each one of those cases. What I'll say is I don't think that we're necessarily seeing just extremes. I think there's reason for everybody with those conditions to obviously always take control and have the optimal health they can. But most importantly right now, to really try to limit access to people who are sick and exposure.
Question for Dr. Beebe. Can you talk about why there are few or no confirmed cases in some of the rural parishes? Those seem like the parishes that are left. Is that because of a lack of prevalence of testing, or is that something specific to the isolation of the parish?
No, I think at this point it's largely a function of testing. As we've seen more high-volume testing sites, whether they're done by municipality, as we saw in Lafayette, or they're done by hospital systems, as we've seen in other parts of the state, we start to see not only the places where the parishes where those test sites go up, but also the feeding parishes around them go up. And so I think where we see that there's 0 cases still, we're concerned. We're not seeing people getting tested adequately there. And I think that's the case throughout the state.
Thank you, Dr. B. Any other questions? Yes, ma'am.
The Florida governor has announced that he is going to start screening people who come in from Louisiana, not just New Orleans, but the whole state, and he's talking about the possibility of perhaps setting up some sort of checkpoints to get into the state for drivers. Have you heard anything about that? And what do you think globally about governors like in Texas and Florida creating these restrictions about dealing with people from our state?
Well, first of all, to the degree that what they are doing and saying underscores what I'm saying, and that is people need to take this seriously, that we have a significant issue here in Louisiana with the case count and the trajectory that we're on in terms of case growth. I think that is helpful. I am encouraging people from Louisiana to stay home, so I think that it should be a small number of people who are on the road going into Texas or going in to Florida. So, I've got my hands full here with responding to this crisis, and I'm not going to second guess or criticize what other governors are doing or not doing. Yes, sir.
Did the state get any warning or advisories from the CDC before Mardi Gras to indicate either it shouldn't go ahead or any kind of red flags or anything?
I can
like
tell
that?
you, I did not. And Dr. B works at the Office of Public Health at LDH. He did not. If I am not mistaken, at the time of Fat Tuesday, there were around 15 cases in the country, all of whom were either tied to direct travel or indirect travel, meaning they had come into the country from one of the hotspots, principally China, or they were in direct contact with someone who had. And so there was never any suggestion by anyone. And look, I think it's interesting to consider, and I know that there are working theories that the 1.5 million people who participated in Mardi Gras and traveled and so forth likely seeded the virus. I happen to think that that's probably correct, but trying to figure out how it got here right now isn't as important as making sure we're doing everything that we can to minimize the spread and appropriately respond by surging our medical capacity. And so I don't want to take time and attention away from the task at hand in order to discuss what is at present a theory. And I'm sure that some student is going to get a doctoral degree one day by doing a dissertation on this. Yes, ma'am.
In terms of the prisons, now that we know that workers at least 2 state prisons have contracted the virus, what are you doing in particular in the prison populations to make sure, I mean, they're obviously very tightly congested. What are you doing to make sure that you can limit the spread there?
Well, as of this morning, with the UCG meeting we had via conference call, there are no positive cases in our state prisons in terms of inmates.
For inmates, but not the...
That's correct. And so I need to make sure people understand that. Secondly, we were among the very first states in the nation, if not the first, to discontinue visitation, not just at our prisons, but also at our jails, and then with hospitals and nursing homes, for example. We know that PPE is going to the prisons so that they can care for inmates. We know that people are being screened for health to see if they have symptoms such as a fever and so forth as they come in to go to work. And if they have a fever, they're not allowed to go to work. They are paying particular care to those inmates who are in those most vulnerable categories, either because of age or chronic health condition or both. And so I can assure you that we're doing everything that we can in order to protect the people that we have in our custody at our state's prisons. It is a challenge, just like it's a challenge for everybody across the state of Louisiana. But I'm confident that the work that Secretary LeBlanc and his team's doing is really commensurate with the challenge that they face, and they're doing a good job.